Hi, everyone. Welcome to our final weekly summary. I'm sure you'll be happy about that. Welcome to week 8. So, just a couple of days left to go. So, last week in our discussion, we had really focused on, for the most part, what our topic was for your paper. So, that kind of population level intervention that you were doing your policy analysis on. So, some folks were choosing kind of a policy itself and kind of backing into the issue. And some folks were choosing an issue and doing some research on policy. And either option was fine. I know a lot of folks were choosing the opioid crisis. And it's I had a conversation with one student in particular. If everyone chose that, and I think I put this in the boards as well, if everyone chose that, that would be perfectly fine because that is probably the issue of our time currently that we can deal with from a policy perspective. And what's interesting in particular is that the way that many states and localities, and actually, kind of the federal government as well, the way they're dealing with that from a policy perspective is probably not terribly effective over the long term. So kind of analyzing the policy, um, the way we're dealing with it from a policy perspective, and digging into that, looking at data, and considering what are some other intervention options is really a good thing. And as I had said to someone else individually, if someone in this group can come up with a really great way, or even if collectively we can all come up with a great way to deal with this, that's a good thing. So if everyone were to look at that topic, I would not have a problem. Um, but that's where we were, and I'm looking forward to reading your papers this week and getting feedback to everybody. It's been well, the whole summer has been crazy busy because I'm trying to move my house from Binghamton, New York, to Pittsburgh after having lived in New York for 20 plus years. But it's been particularly crazy busy this past week because my husband actually started at Duquesne this week, so it's been particularly nuts this week, so I apologize for that. So I do want to go over quiz questions, a few of them. So the first one was, which of the following is a real-world example of the ethical decision-making principle of respect for autonomy? So these back over here. So the answers, I won't go through all of them, but the answers, the correct answer was advanced directives. When you think about the principle of respect for autonomy, that's really that notion of self-determination. So the ability to especially of the patient, in our case in healthcare, the ability of the patient to make their own choice for their future, for their care, for whatever. And when we're talking about advanced directives, that is obviously the patient making that choice for their future care in the event something catastrophic happens to them, making that choice for what care they want to have down the road. So having those advanced directives in place gives them that autonomy. We are respecting their right to self-determination in the future. So respect for autonomy, advanced directives is the proper real-world example of that ethical principle. Next one. Typically, organization designs have both formal aspects and informal aspects, true or false. And this is true. So when you're thinking about an organization design, it'll have both formal and informal aspects. When you're thinking about the formal aspects, obviously there's going to be all kinds of relationships and patterns within those organization designs. Those those patterns and relationships that are truly set are going to be those formal aspects. But there's always going to be kind of informal aspects that will build. So I'm trying to think of a good example. like for example here, and this is obviously not a healthcare organization, but here at RMU, we have an organization design that is built upon schools within the hierarchy of the overall university and all the different schools within. And so that's a very formal structure. But then, we obviously kind of have some informal aspects where we build relationships, those, kind of informal relationships between schools where that's kind of that informal aspect. We build those relationships between schools where we help one another out. And a good example of that is with data analytics. So obviously in healthcare, we use a lot of data analytics. I just developed a course in data analytics for our program, for the undergraduate program. So, but we have a whole school of computer information sciences across the street from us. So, so we kind of work with them, and it's that informal aspect of organizational design where we work with our colleagues to kind of help one another out. That's that informal piece. The formal piece are those formal patterns. But then there are those informal aspects where it's not just a kind of a friendly collegial thing, but we do have those informal elements of organization design that are relevant to actual work going on in the workplace as well, and that definitely exists within healthcare also. So hopefully that helps to explain it a little bit. Last one is all policies influence and are influenced by their external environments. True or false? And this was true. And this is when you think about policy, policy making overall. You've got obviously they are going to influence their external environment, but they are also influenced by their external environment in the policy making process, and then throughout that entire process of policy making, formulation, and then through monitoring, and then possibly modification. All of that is there's definite influence by the external environment, and that's actually part of the what's the word I want to use? It's purposeful in the policy making formulation process. You want policies to be influenced by the environment in which they live. Because that is hopefully will hone that policy to be functional within that environment. Sometimes it's negative on that policy because if a policy is too politically influenced, then it could be a negative. A good example of that could be for example, Medicare. How Medicare for many years was not put into place because of the political influence from the external environment, or changes. For example, the Trump agenda to make significant changes to the Affordable Care Act. So sometimes the political environment can have negative impact on policy, depending on your political view, I guess. But it can also have appropriate impact on policy. So it's important to know that policies do influence external environments, appropriately so, or sometimes in a negative way. When you think about policies influencing the healthcare environment, policy, regulatory, and one of the popular sayings when a new regulation comes out that puts a burden on the healthcare industry, we think of unfunded mandates. So when you think about a big regulation that comes out that requires more administrative work by the healthcare industry, it's often noted as an unfunded mandate. Okay, we have to do all of this additional work, these quality programs, ICD-10 when that came out, HIPAA, all of these things come out, compliance programs. All of these things come out, but there's no funding from the government to have us do them. They're noted as, sorry about that, my light went off, unfunded mandates, and it's problematic for the organization. So it's magic, lights back on. So just to wrap up, it's been a pleasure working with everyone this term. If you need anything over the next 8 weeks or so, you know where I am. And I think I'll see everyone again in population health, which is the second half of the fall term. But again, it's been a pleasure working with everyone, and have a great rest of your summer. I think you've got a week or so off, which is awesome, and have a great beginning of the fall. And talk to everyone soon.